Come on, computer. Hi, welcome to another Cafecito with United Latinas for Mental Health Awareness Month. I'm so honored and so grateful to have Dr. Eugenia Flores Millender here with us today for this very important conversation beyond mental health awareness. So thank you so much, Eugenia, for joining me today. Really am so excited for everybody to hear all your wonderful wisdom and insights today.
Thank you for having me.
So, as I like to start, I want to learn a little bit about you, your background, what you do, how you got to United Latinas, how we're here. So, tell us a little bit about yourself.
Yes, Eugenia, like you say, I was born and raised in Panama, the Republic of Panama, and I came to the United States when I was 12 years old. My mom was here a few years before me, and I honestly did not know what I was getting into at 12, just like everybody else. Came to Brooklyn, New York, and lived there for a few years before moving to Florida. I had a lot of changes in my life. Imagine, leaving Panama 12, just graduating from sixth grade and coming to a whole brand new country, not speaking the language. So trying to assimilate a lot, not quite understanding what group I fitted in. Being Afro-Indigenous Latina, I fitted in multiple groups. And sometimes it was really hard, for any group to identify with myself or for myself to identify with any group. So I deal with a lot of stress, experiences migration, marginalization, identity challenges. I experienced lots of trauma throughout my experience, my life, both personal and also in the neighborhoods that I lived in. And eventually, I found my way into the army that paid for my college,
Wow.
became a nurse later on, and I love trauma ICU, open heart ICU. That's really where most of my bedside experience was at, until I experienced a personal family member who was living with mental illness. And at that point, I really did not know anything about mental health. And I was a nurse, so it wasn't like, oh wow, it was something distant. Obviously, we all heard about mental health, but it's different when it hits home.
Yes.
So he was misdiagnosed and mismedicated. And at that point, it really came to a point where, well, I needed to become an advocate for him.
Mm-hmm.
So I switched literally from, acute care setting to mental health setting, and really wanted to become more involved, and then become a psych nurse practitioner. I not only did want to provide care, but also wanted to change policy and research. So then I became a researcher. So I got my PhD in nursing, and now I am a full professor at Florida State University, and I'm also a co-founder and co-director of the Center for Population Science for Health Empowerment.
Wow. Very impressive and amazing, and so much to unpack. First of all, love Panama. Beautiful country. Um, I also know the idea of straddling multiple cultures and multiple environments and not belonging anywhere, which definitely can impact your mental health and well being. And so powerful what you said about nurses. I've spent many, many years working in the healthcare system. And one of the reasons I created and do the work I do is to help caregivers better take care of themselves. And my heart is all about nurses because I feel like we underrate nurses and we don't give them
We,
enough credit. And but at the same time, nurses have a hard time taking care of themselves. And
yeah,
it's so interesting, Eugenia, that you said being a nurse, you weren't as exposed to the mental health and the psychological aspect, which is so fascinating because you would think that through nursing school there would be elements of that would be taught, right?
correct. And there were some elements, but not enough. And I think that's also part of the problem, that we are not exposed to the severity and the different places that you could really encounter mental health.
So, with that said, we do a lot of talking about awareness and awareness, right? And it's Mental Health Awareness Month. But you say something that's super interesting, which is how do we shift the conversation from just awareness towards action?
Yes. Well, so I am so excited that we are actually speaking more about mental health, and awareness is extremely important. But awareness by itself is not enough, right? Because
No.
awareness is not going to make you get access to care. People don't heal from awareness. People actually heal from actually having access to different settings in different places that give them the kind of care that really could represent them, or that they feel walking into to the doors of somebody's clinic or office.
Right. And we talk about policy and changing policy, but from like especially I think diverse communities, right? Because there is still a bit of a taboo around talking about mental health and getting help and doing those things. So from your perspective, what role should the community play, right, culturally in doing this action, right? In motivating people to say it's okay to not just be aware, but to take action.
This is something truly close to my heart because I would say I'm honestly a community nurse. I love the community. Give me a clinic in the community much easier than being in academic settings or in a hospital, because I truly believe that this is really where the difference could be made. You cannot develop a solution without community partners. You cannot develop solutions without the people who are actually living the experience. So to me, the community has to be in the leadership position when you're developing these interventions and when you're developing these ways of being, when you're trying to understand what's important to the individual, their family, and the community. We are not going to solve mental health in silos. Me in my head as a clinician cannot understand everything. In my head as a researcher would not be able to understand everything without the collaboration and the true, authentic leadership, bi-directional relationship with a community partner.
And can you talk a little bit more about the importance of community partners and who they would be, for instance?
Sure. So one of my main partners actually will be the individual who's living this experience, right? Because
Right,
one person could have bipolar, schizophrenia, depression, and it could look totally different every single time. Because that diagnosis, right, or those symptoms, the experiences, it really evolve around the environment, the support system that they have. What is the perception and beliefs about the illness? So they are my main partners. Their family are the main partners as well. And then the system that surrounds them are also another great partner. So as a clinician, I could tell them go and get this medication. Well, they may not quite understand what the medication is about. It may require a family member to be in the room with them. The family
right.
member may also have their own perceptions of mental illness and medications, right? So they have to be informed. And then let's say they have to go to a pharmacy and they may not have a local pharmacy that has the medication, or they don't have the resources. So all those partners are key to developing and improving the mental health system in our communities.
That's amazing. And do you do outreach within the communities too to help people understand that? Like, do you go through a community center or a church or different things like that to help people understand? Do you consider those your community partners as well?
Absolutely, absolutely. So, just a little story about myself. So, when my close family member was diagnosed with a mental illness, we knew something was not quite right, and then he was eventually diagnosed and eventually treated. I had to honestly spend many years educating my own family.
Yes.
And it took years and years and years of talking about it, what it meant, because for whatever reason, our own views of what it was before is not what it is now. And I am so happy again that awareness is important, but awareness by itself is not enough. Where we have to educate our community partners, where we have, and those community partners are people in different religious settings, right? Churches, community settings, it could be different work settings. It could be, different local foods, barbershops, whatever that, wherever people are, we have to meet them where they are. We have to go there and educate them, and also share resources that may be available in different communities. And they may look totally different in different communities, right? And they should, because it should be mirrored the need of the community that we're targeting.
I love that. That's amazing. It's sort of bringing it down to boots on the ground, right? And meeting people where they're at is so important. Sometimes we forget to have that awareness of who's in front of us, right? And meeting them where they are. And that leads me to my next question. let's talk a little bit more about the Latino community in particular. And what are some of the barriers? I think this is a two-part question for me. What are the barriers to them accepting and realizing the importance of mental health, right? And also, what are the barriers to them getting the support and services they need? So, sorry, I know that's a really big question in two parts, but I believe you could answer it.
That's a huge question. And I have been battling that question my whole life with my family, about community, because I would say definitely the Latino community, we are very resilient, but the
Yes,
systems sometimes are not designed for us, right? So again, my mom is very a different generation than I am, right? Both Latinas, different generations, grew up in different places. So her perception of what mental health is it's very different than mine. And the perception of my children is also very different. So how we speak to the different generations in our Latino community has to shift, right? For we have a big stigma and fear of being judged, right?
yes,
And that shifts it with the different generations. The lack of the language barrier. So you may have a number one, mental health professionals are very limited. Now,
yes,
when you look at mental health professionals in the Latino community that understands the Latino culture, that speaks our different languages, right, is even smaller. So we have a barrier there. Um, Again, the culture is a big difference. I spend a lot of time when I have patients in my clinical hat, where maybe the first or two or three visits is all about education, and I don't force
yes,
anything. I may indicate you may need medication, but I also listen very clearly to see are they open to the medication or literally like who is making the decision. Sometimes it's not that person, it may be somebody else in the family, so I need to educate them both, and I'm open to them trying some of the holistic approaches that we're very familiar with, in a way of also making sure that they get the care that they need in a manner that's not going to be unsafe for them or anybody else. So we have so many, financial barriers, transportation, distrust of the system. Um, I remember when I came to United States in New York, I went to a health department with my mom, and I was smaller, younger. And the kind of care she received also always stayed in my mind because she wasn't treated like a unique human being. She was treated like a number. And that always stayed with me because one of the reasons she wasn't necessarily, given the respect she deserved as a human being was because she didn't speak English, right? So and back in the 80s, when we were in New York, there weren't many translators or any at all.
no,
So it was meant like, oh, wow, something else that we have to, worry about. So, and the lack of insurance put many of us in different places that don't provide quality care, right? So there's so many different barriers that the Latino community face. But again, we are so resilient, and resilience should not be mistaken for a lack of need.
yes. That's such a powerful statement. That is such a great statement because we look at resilience as part of our superpower, which it is, right? Especially as Latina women. But in general, we do look at resilience as our superpower, right? And our ability to hold space for everyone and be there for everyone. But at the same time, we need to recognize that we may also need support and we may also need help on the other side of that, right?
Exactly.
And not to plug this, but I think that there is a huge opportunity for our children for careers for the Latino community in mental health careers
Yes.
because we don't have enough people that understand our language, our culture, our DNA, our background that can provide these services, right? And also, interesting enough, and I would love to hear your thought on this. I was talking to a dear friend of mine who's a psychotherapist, but she's from Argentina. And there is definitely cultural nuances amongst our community too, right? And she was saying that sometimes it's harder for her to treat people from other countries in South America because maybe the nuances, the language, the thought process may not be the same. What are your thoughts on
Oh,
that? I would love to hear that.
completely agree. So I go back home. often because I do research and do a lot of community collaboration in Panama. It has been actually a blessing, and I'm very fortunate to be able to do that. Because coming here and then going back to provide resources, I think is definitely a gift. But I would say that being um, from different countries, they have not necessarily have that awareness like we do have here, right? Um, it gives more of a stigma. So now, for example, in Panama, mental health not hasn't necessarily been explored or even assessed in every visit. At least here, United States, we are integrating mental health in primary care settings. So that's good. So we
That's
hear more
great.
and more about it. Correct. But I think that because we don't speak about it in other countries, when you have those individuals that come here and they often talk about it more than in their own country, it becomes a thing like, oh, maybe you just want to over medicate me, or maybe you're just relying on medications often more than in the holistic approaches that we do back home. Well, I think that the experiences are different, right? So if you have individuals that come from another country, for example, from Panama, every time I go home, I feel more peace because the hustle and the bustle is not what it is here in the United States. And those
Right.
environmental factors does impact your mental health wellness. You're more stressed because you work many more hours. Your body's not sleeping well. You're not eating enough. You have so many different hats that you wear. Believe me, I know this. And we don't know how to take 5 minutes just to deep breathe or take a walk out in the sun that actually releases your own natural serotonin levels. So it's a big difference in cultural shifts. So when you have individuals that come here and are listening to how aware we are, right? But they also may not have the systems that is there to support them. It's a big disconnect. So it is difficult. And that's why we do need more individuals that are aware in the cultural beliefs to be mental health professionals, to be able to speak to the individual and the individual feels listened to. They feel, that you're not just looking at me as a disease or diagnosis or symptoms. You're looking actually at Eugenia, and you're talking to Eugenia about what's personal to Eugenia, not just everybody else.
I love that. Okay, I'm going to slightly switch gears on you, and I want you to put your research hat on for a moment.
Okay.
And can we talk about um, the future of mental health systems and how do policy, workforce development, and innovation need to work together to create a real impact? Because I know that's also part of that's important, right? And in getting the research and getting the word out. But we also need support from our workforce, from policy, from healthcare, right?
Yes. Oh, wow. You just throwing all these things in the pot. Wow. This is another big question. So, as a researcher, I have always fought for community partners to be my equal when I do research, right? So, in research, you have, the government, the NIH, that give you money as a researcher to do research. I don't do research by myself. I do research with a community partner that is an expert in providing services,
I
right?
love
So we
that.
need to have more of those. Those are very rare, when it
Yeah.
comes down to funding. We need to advocate and have more of those where I cannot do my research as a researcher by myself unless I have a community partner as my equal. So more of that. We have to fund more mental health in community settings. We have to fund more integrated care where if we know that most of the population are getting their overall health in a community primary care setting, we need to bring mental health to that setting, right? We need to meet people
Right.
where they are. We have to fund a workforce, um, diverse. Diversity is a big thing now, right? And, a workforce that reflects the community we're serving. So the same topic we were talking about, the workforce understands the community, is not afraid of going in the community, is not afraid about talking about culture, is not afraid about talking about holistic approaches, is not afraid about talking about the importance of the combination of herbs and medications, which I think is big in our community. We need to make sure we are doing more trauma informed and culture responsive training. So it's so many things. And now with AI in telehealth, we have to make sure that we are providing those things in a culturally multilingual approach. And we're not leaving underserved communities like our like Latino community behind because we don't have access to these innovations.
Oh my gosh. I so powerful what you just said. It's like having that access and bringing it to the community, to community centers, to clinics that are part of the community. Like I think is so, so important, right? Of saying, okay, you go to this clinic will also offer mental health services. And I think also for our community, there's still that respect for the medical professional, right? And there's, especially in older generations. I remember I used to argue all the time with my parents, and it was like, oh, pero el doctor dijo. And I'm like, okay, el doctor dijo, but, and they're like, no hay buts, el doctor dijo. And I was like, okay, but we can have a conversation about it, you know? And I think
Yes.
what you said earlier in our conversation is so powerful as to what our parents thought, what we think, and what our kids think, right? But there is that element of understanding too, like now the cultural nuances and the relationship that we have with el doctor dijo, you know, or
Yes.
la doctora dijo, you know, and I think it's so important to incorporate those things, especially when it comes to mental health.
Oh, absolutely. And just because of that topic, I will say that when patients come to me, I tell them clearly, I cannot do this by myself. You are the expert in how you feel, how the medication makes you feel. Is this working, not working? So I cannot do this. We together are the experts. So and sometimes we're so busy that we forget little things. So maybe writing things down on how you feel. So again, visits are very short now. It could be 15 minutes, could be 30 minutes. But in that, you have to be very mindful of what you want to share. And if you always think that we are the experts, that's not true. You are the expert, and you have to tell us how you feel in order for us to then take our expertise of what's in the DSM-5 or what is in different type of therapies to be customized to what's important to you and your symptoms.
I love that. That's a great takeaway for people listening to us today is take a moment, write down your symptoms, write down what you're feeling, or if it's your child or your partner or your loved one, or like you had with your relative, like write down what they're experiencing or what they're, so you can come informed into the conversation with Eugenia or a practitioner that's going to help you. I think that's such a powerful, valuable tip that we don't think about enough, right? Like I know in other elements, like I've always said to patients or people, like if you're going to go in and have a conversation with the doctor about cancer or something like that, write down. But we don't talk enough about writing down the symptoms or the thoughts when it comes to mental health.
Absolutely not. And because we also feel a little afraid or ashamed to talk about it when we go into the offices, right? And you think, oh well, I just need to slow down. But if this is happening over and over and over again, that's something that we need to start talking about. And I think that as a family or community, because family may look very different for each one of us, that we need
Of
to
course.
pay attention when people keep saying things over and over again. And at some point, it has to be, maybe we need to look for a mental health professional to help us understand the solutions and the different opportunities we have to make you feel better.
And can we go back to one thing? Because I think it's also really powerful for people listening to us or are going to see it. Can we talk about the generational differences for a second? I would love to get your input on the kids of today, like how your kids are reacting to this. Because I think a lot of our participants, listeners, members of United Latinas have children too. And it's interesting to get your perspective on how they're seeing it, the kids, I mean.
Yes. So the younger generation are speaking more openly about mental health. The other is speaking very openly, or their symptoms or their personality shifted dramatically for you to be able to see the differences, right? So if you have a child that per se often speaks or is often doing certain things, and then this is shifting where they're no longer doing that, it may be because maybe the stress level is a little elevated, and we want to figure out what is causing that to happen, right? And having those conversations. And maybe sometimes it just, as you said, hey, mi amor, ¿cómo estás? Is something happening that we should be talking about, over and over again? And then eventually, they will always have a very guarded, initial, response. But eventually, if you look at different settings where you could talk about, ask this question, they're gonna let this guard down and let you know. So I think that younger generations speak about it more, or do the opposite where their behavior will change. the older generation is a little harder. And I would say that I have, and again, I don't want to say specifically, but I have older family members that you say, hey, listen, what you're having is not chest pain, it's most likely anxiety, right? And because I've been around this person for many years to know what it is. And they said, no, they said, okay, yo te estoy diciendo, I know what it is. I said, okay, I bet you that if you were to take something, it probably will also make you healthier. And what we don't really look at is we don't see the connection between mental health and physical health. If you're
Mm,
always anxious or you're always feeling sad, and you're not taking care of those things by holistic approaches, or shifting the way you take care of yourself, like more sleep, eating healthier, exercising, then those things will eventually impact your physical health, right? Your cardiovascular level, your diabetes, your hypertension. So it's all connected. So if you don't take care of your mental health, you're also not taking care of your physical health.
I love that. Well, that's what I preach every day, the mind body connection. So thank you for mentioning that because I spend hours every day talking about the importance of your mind body connection and that you're one whole being. And I
Absolutely.
think that there's definitely, we're getting a little bit better, but there's definitely issues in Western, traditional Western medicine where they just treat the specific symptom and they don't treat the whole being. And I love that you're bringing that up because it is such a strong element, right? If you're
Mhm.
not dealing it, I always say, becomes like the body whispers, it speaks, it screams, and then God forbid. But there's always a cycle that happens between the brain and the body, right? On whatever it is you're dealing. So I love that you brought that up. It's super important. And before we run out of time, there's a couple more things. And one of the things, and you're going to tell me it's another big question, Eugenia, so go with me on this. What's one of the things that's giving you hope about the things you've seen most recently in mental health in our communities, in the Latino communities? There's something that you're saying, wow, this is truly getting better, or this is giving me hope.
Yes, I would say definitely that what gives me hope is that communities are no longer waiting to be invited into the conversation. They are leading this conversation. They're demanding to be part of this research or this clinical trial or the solutions. And we're just busting doors. And I just want to do that more and more and more in every single community we possibly can.
All right, everybody, listen to her. Whoever's listening to us and listens, get involved and bust down those doors. Do the research, support that. So my last two things for you before we run out of time is I would love to know one key message you want to leave our listeners, participants with that they could either give to their families, their children, themselves. What is that for you?
Yes, that mental health is not a luxury at all. It is part of our overall health, is our part of our families, is part of our communities, is part of our future. And no one should feel that they have to choose between being understood and receiving care. Healing happens when people feel safe, when they feel heard, when they feel valued, when they feel connected.
That's really beautiful. And to tie into that, in terms of where can people find resources or listeners can access mental health support in their communities? Do you have some suggestions on where they could find these things?
Yes, yes. So, if you have not heard, we have the new 988 crisis line that it should be available throughout the nation. And then in some local settings, you also have 211 or 311. So those numbers will connect you directly to resources in your local area, no matter where you are in the United States. You will definitely have your primary care providers. They may have access to different mental health services and also could send you referrals. Local community health centers are a major support system for the mental health system. School counselors, faith and community organizations, and obviously, if you are in a remote area, having access to telehealth resources is also a great way of getting care that you really need.
Amazing. Those are super valuable. And Kenya, if people want to find you, if they want to speak to you, if they want to reach out to you, where's the best place to find you?
Yes, just look for care for all of you as a clinician, and then you can also look me up at Florida State University if you want to do any kind of community engagement research and collaboration.
Amazing. Um, I so appreciate you being here with me today. This was so powerful and so interesting. And I really hope that everybody listening to us learned something. I know I did. Your work is so powerful and so valuable. And I thank you for getting out there and using your voice for all of us. Um, Really an inspiration, Eugenia. Thank you so, so, so much for doing this with me today.
Thank you for having me, and I really appreciate this.
Thank you.